Dr. Martinez, tell us, children. You do see children. You do see a fair amount of children in your practice. Is that true?
I do. I actually, I have been a dentist for 19 years, but previous to that, I was a dental hygienist. And my very first position was working in a infant clinic. We used to treat babies from 6-month-old babies to 18-year-olds. It was a pediatric clinic, and that was my first experience on dentistry. I have now been treating my patients, their children, and it's wonderful. And actually, when I became a parent, I realized how difficult it was. I used to be very, kind of judgmental, if you will, before you have kids, to say to a parent, get them off the bottle at 1 year and do this and do that. And then when I started having my own children, I realized how difficult it really was to change all that. And my perspective changed completely. And now I'm like a lot more forgiving when patients tell me, I can't get them off the pacifier, or I can't get them off the bottle. I totally understand now. And doesn't make it right. I mean, it's not a healthy habit, but I can totally understand that because I have a different perspective.
Right. Well, tell us why, in relation to overall health or to the teeth, getting off the pacifier, getting off the bottle, not sleeping with a bottle of milk, falling asleep with a bottle of milk, or maybe while breastfeeding. Tell us about the consequence of that stuff.
What happens is we know when children when we put our children to bed with a bottle, what happens is their last sip they take, it pretty much sits in their mouth once they fall asleep. So that milk is just sitting in, and it's very sugary, and it's just sitting on their teeth, causing all the bacteria in the mouth that already exists to start breaking down the enamel of the teeth. There is such a syndrome that's called nursing bottle caries, when we see with little babies, 8-month to 3-year-old kids, where all their front teeth and their first molars are decayed. And usually this is from children being fed this bottle at night. Not all of them get it, though, but children that have weak teeth to begin with. Also, it's very, very common when you see a child, and I'm sure people know families that have had this issue where the kids are walking around with their bottle with juice in it all day long. So it's a constant insult of sugar onto these teeth. Couple that with parents being too tired to take care of their kids' teeth, with a little gauze and water, because sometimes that's the last thing you want to do at that point. You want to just go to sleep after you've been running around after your baby all day long. But coupled with that and lack of care, and you will get a baby with problems. Again, it doesn't happen to everybody, but it's very, very common. And that's why they wrote about it. And that's why we always talk about children, why it's important for them to visit the dentist at a very early age, and why it's important to brush their teeth as well. I have a lot of parents that don't think that that's important, that because these baby teeth are going to fall out, that it's okay for them to have a cavity on them. And that
tell us, when should a parent bring the baby to a dentist, and what should be the action there, kind of like, because if a child has little or no teeth, I mean, there's maybe nothing to do, but tell us a little bit when children should go to the dentist.
Sure, I'll tell you what my feeling. For instance, there are children that are very independent. There are children that are very, you don't even have to tell them to sit down in the chair at 2 years old, and they will walk in and sit down. Mind you, when they sit down and they realize that it's a serious thing, that you're going at them with gloves and a mask, they start crying and they might walk away. I always tell parents, for instance, if I'm seeing the mom or the dad, to start bringing the baby. Of course, sometimes they actually bring the baby, but when they're 2 years old, they start getting familiarized with the office, to seeing that it's fun, that it's there's nothing wrong, nothing's going to happen to you here. The worst thing they can do, and I hear it all the time, is if you walk in here, the doctor's going to give you a shot, which is actually the worst thing anybody can do, to scare the babies with with the threat of a shot from the dentist, because you'll never get them in there. So I really think that it really depends on the maturity level of a child when we can actually do some work on the child. But sometimes it could just be a fun, let me take a quick look in there, check at 2.5, just to make sure that things are going okay. Granted, we might not get anything done. You're absolutely right. But I think at least as the patient, the baby sees that there's nothing wrong, that it's fun, that it's exciting. I think especially if they have siblings, they start wanting to be just like their older brother or their older sister, and it becomes a fun experience. Versus having to have a child come in when they already have an abscess, when they have a big cavity, for their first time to get treated. Because these patients will typically become your worst patients ever. And I don't blame them. They're little kids and they're hurting, and you're going to cause a little bit more pain for them. They don't know that you're trying to help them. They don't think they're babies. They don't realize that. So they will become very afraid of you. Those are the typical stories I hear all the time. Oh, when I was a baby, this happened to me, that happened to me. Usually that happens when, again, their first experience going to the dentist was a traumatic experience. And usually that happens when we wait until it's not a fun experience. We're going to have a tooth pulled, a big cavity filled, stuff like that. So I always recommend, as soon as you can get them in the chair, just for a quick check, I think it's very, very important.
Basically, let's not have that zoom drill going on the first time they come in there and it coming close to your mouth. Just make it play, and every time a little more and a little more. And if you do that, chances are she never needs the drill or he.
Exactly. Preventative dentistry is a lot less costly, less painful than any other type of dentistry. Actually, some insurance companies are rewarding their patients by using their preventative benefits, where they're telling patients, you know what, you can have cleanings 4 times a year, because they're finding that it is cheaper for them to pay for cleanings 4 times a year than to pay for root canals and to pay for gum treatment and crowns and all that stuff more often. So they're actually rewarding their patients with preventative payments of their treatment.
Absolutely great. Again, wonderful information, Dr. Martinez.
Thank you.